I'm Kelly Worthman in the CBSN Denver studio. November is Diabetes Awareness Month, and diabetes is a major cause of heart attack, stroke, kidney failure, even blindness. So joining me now is my favorite, Dr. Frank Chae. He's a bariatric surgeon with the Denver Center for Bariatric Surgery. Dr. Chae, we always love it when you're here with us. But what we want to talk about is right now, 1 in 10 American adults have diabetes. And according to the CDC, 1 in 5 will have it by 2025. So I'm curious, does this concern you, and what are some ways to prevent this?
Right now the estimated number is as much as almost just under 100 million Americans are suffering this diabetes, which mostly can be prevented. There's 2 types of different diabetes. Type 1 is fortunately few in number compared to type 2 diabetes, which unfortunately is the vast majority. And these are, a lot of it's preventable, and there are certain countermeasures we can take to prevent from getting there. Or if you're already there, or somebody suffers type 2 diabetes, there are measures, both medical and non-medical, that people can adapt, like lifestyle habits, to change that.
And, we know that COVID-19 hits those with weakened immune systems even harder. So, Doctor, I'm curious, how is the coronavirus pandemic even affecting those with diabetes?
Unfortunately, it's hitting the diabetic population very badly. The severe complications is just wreaking havoc in the diabetic population. And of course, tied into that, it almost goes hand in hand, is obesity as well.
We were looking up some other statistics, Doctor, and according to the National Institute of Diabetes and Digestive and Kidney Diseases, this is one of the most chronic conditions among school-age kids, and we also know this year's Awareness Month is focusing on taking care of youth who have diabetes. So what are some things that families can do right now?
I think the easiest first step that they can do is change the lifestyle habits. If we can just increase our physical activity and aim to lose as little as 5% of your body weight, that can go a long way in preventing type 2 diabetes or even getting rid of diabetes. And the easiest measure is to just walk, just go out there in the parks. I know during the shutdown, the smoke from the fires, it was hard to do, but you can do it also indoors too, like at a big shopping center. And I think that would be the easiest thing. And just simply walking the dog a longer distance, maybe pushing yourself 5 minutes each day to walk longer and longer. The other adaptation is choices of food. If we can just try to minimize little at a time the processed food that we are feeding ourselves and our kids, such as trans fat and high sugar foods, we all know that. If we can switch over to more wholesome foods that is bright in color, brighter the colors, the better. And just making small shifts like that can lead to even 5% of weight loss and make a tremendous impact on people's lives.
And as a bariatric surgeon, is diabetes something you commonly see in your patients?
Sadly, yes. There's no question that diabetes and obesity go hand in hand. And in fact, we do bariatric surgery or weight loss surgery more for curing type 2 diabetes rather than just focusing on the obesity itself. Because there are patients who, despite all the active measures that one takes with diet change, lifestyle change, medical therapy, they just can't do it because of the disease process. And that's where surgery comes in to get rid of these, to help protect themselves from heart attack, stroke, and COVID complications.
I've talked about diabetes before with even family members who have it and other physicians. What are maybe some of the misconceptions, Dr. Chae, that you've heard about this disease, and either for people who have it or people who think that they might get it? I mean, is there anything that we can do to better understand how this disease works?
Again, I think the key word is obesity. It's intimately tied in with obesity. So if somebody has gained a lot of weight in the past several years, they really should be aggressively tested for type 2 diabetes, because it's really a silent killer. When the classic symptoms of diabetes, such as increased hunger, increased thirst, fatigue, blurred vision, by that phase, it could be already too late and full-blown diabetes has taken place. So just proactively, a weight gain is a warning that type 2 diabetes is probably coming their way.
All right. Well, Dr. Chae, as always, we always enjoy having you here, and we appreciate your insight. So thank you so much.
Thank you, Kelly.
We'll be right back.